Hello, everyone. I want to call the meeting to order. Thank you for being here. We want to approve the minutes.
Yes, so we have the January 8th minutes, so that's the first up for approval. Yep.
Yes, I have no changes or amendments.
We have a, to approve.
They're approved.
Okay, let's move on to the consent. 3A, APD and AIPC memorandum of understanding.
Real quick summary on this one. This is just, do we have Chief Hildebrand here, or Chief, you want to touch it, or I think I can. I think this is the one that is the update just because of the incidents a year ago or 2 years ago.
Yeah, basically what we had is with our MOU established with the ICE facility is we had an event where 3 individuals escaped. The verbiage in that MOU was very consistent as far as timelines of when they would call us, when they wouldn't call us, what the expectation was, what the expectation was not. It was really put us into a very, very tight little box. And again, there was some huge blowback at that time based on the fact that they felt that we did not give the response that we needed, to the point that I actually did a press conference and demonstrated the fact that this call for service came in almost 12 hours after these individuals have escaped the ICE facility. And there was no accountability component based upon our MOU agreement with them, that we would be responding to that based on the fact that this was not an ongoing or ongoing investigation. So with that, we met with them, wanted to have open chains of communication and verify that we are all in the same place. And that's what this new MOU does. It basically takes away the timeline of when they're going to call us and not call us. And it takes away the fact of what we are going to do as far as a hot escape or a cold escape. And it just puts it in more normalized verbiage that says that if there is an escape or an event that is problematic for our community and could cause victimization within our community, we will respond to it based upon when we get those calls for service. It also details a little bit more about what we will not do based on the time that someone leaves a facility, the extent that we will or will not do. So really all it is just bringing in more clarity and taking away some of the very, very specific things that really caused issue with us during that last event.
Any questions about what she said? No questions. Let's move on to 3B, ordinance to amend city code section 134-2.
I think that one, or Mandy.
I can just speak to this one generally. Megan Platt with the city attorney's office. I believe that this was just a technical amendment to bring our code into parity with the state statute on the ABIS provisions. I believe this was regarding just one of the provisions that we were out of sync with the CRS on that. So we just updated it just to bring that into parity.
Can you just give a little bit more background on it?
Sure. So a couple of years ago, there was a bill that was passed, regarding the regulation of the ABIS systems, which are what essentially do our speed regulation in the city. So we have a program where, there's the boxes that you see and they move around to different speed corridors at different locations within the city to monitor speed, sort of a traffic calming measure that doesn't require city staff to do that. Staff evaluates these violations, but there is, some CRS regulations around how those are used and in what areas they can be placed and things like that. And so we did a major code rehaul about, 2-3 years ago on that. And then this is, again, just a small amendment to what we did at that time.
I think that one we actually did, we just did. This one's actually, this is healthcare. I think it's just definition.
Oh, of course.
Basic child seats, car seats,
Okay.
things like that.
Okay.
I think it's clarifying with state statute. So
Okay.
same underlying issue, but just
Right.
clarifying with state statutes.
Okay.
Okay.
And I think the one you're referencing actually went.
Oh, was that the last
Yeah.
one? Okay, I apologize. I'm confusing this month, last month. This one was, okay.
Any questions? No, let's get into general business. Thanks. MD Alley presentation.
Morning, Chair, Council. The council members are here, everyone. My name is Mark Hayes. I'm the Deputy Chief of Operations with Aurora Fire Rescue. With me,
John Hill, Division Chief, Fire Operations. One of the primaries on MD Ally.
MDLI is a collaborative implementation that we've been working with throughout the city. Ms. Bonetta from Aurora 911 has been very point contact for us. A little bit of context for the background to this. Many of you are aware of nurse navigation, which is something we used. It was a telehealth way that people in our community could reach out for some help, having a medical emergency through Aurora 911. And rather than getting a heavy apparatus in an ambulance to respond, they might have had a lower acuity type need that could be handled alternatively. Nurse navigation was a great idea. It was a really great first step. MDLI is kind of the next step in moving that forward in progression. MDLI is a telehealth, a telephone or telehealth for those that have the video capabilities, so they can do both to get as many people as possible for our community to get those kind of help in the lower acuity calls. The fire chief, about a year and a half ago, we rolled out right response, which is getting the right type of apparatus to the right people for the right reasons for what their needs are to address the community's needs. That reduced in a dramatic drop in our heavy apparatus responding to lower acuity calls, and also in a faster response time and faster unit reliability for our heavy apparatus for the higher acuity calls like chest pain, shortness of breath, cardiac arrest. So some of the context for it, we had to go to an RFP because we want to follow the city process to make sure there's a fair and equitable and transparent way to get this implemented, so that there was some accountability and transparency across the community and throughout the city for implementing this particular process. It's been live for about a week now, 1 week, about a week. And so some of the background for MDLI is one of the problems that we've been having in the nation, not just here, we're included in this, is that as time goes on, we have a much higher adult population than we do children. And in fact, 2035, which used to seem like something from a future textbook, is really kind of not that far away right now. The number of adults is actually going to outnumber the number of children in our nation. That means there's a lot higher demand in healthcare and medicine and in 911 and responses. That's why we keep seeing those call volumes going up and up and up. As the population, unfortunately myself included, getting older and older, despite my best efforts, and it's higher demand on our systems. So the other part of this for our community is costs. Ambulances, emergency rooms, all cost money. Not everybody in the world has insurance. Those that do, it varies depending on your type of insurance, what insurance is covered. We all know this. This is a national-wide statistic. It's not reflective just of the city of Aurora, but you're talking thousands and thousands of dollars every time you go to the hospital. Using the 911 system as your health care to be seen may not be the most effective for the resources as well as the emergency rooms, and it's not cost effective for the citizen. So finding ways to get them the care and healthcare they need without invoking all of these systems saves our community members a great deal of money. Problem, as we were talking about, it puts a strain on the ambulance systems. We rely on our partners with Falk, who are joining us here this morning. Thank you. They're not made of ambulances. They don't have thousands that are sitting there. They have a finite number there in the city. The more that we send on lower acuity calls, the less are available for high acuity calls. It's just simple math. So how do we make the most effective use of it? Same thing with the emergency room, same thing with our heavy apparatus. The higher we use these, it's really taxing the system. So implementing something like MDLI comes up with a solution. It's faster, it's easier, and it's less expensive. It literally is faster because through Aurora 911, I could be talking to an ER board certified physician in a couple of minutes before even an ambulance can get there or you're transported anywhere. So some of the things they can do, you can do this right from your home. When they call through Aurora 911, they get relayed over to a telehealth person. It's a US based board certified emergency physician, not just a doctor. Their specialty is emergency medicine. A couple of the things they can handle is everything from prescription refills, chronic pain, cold, flu, nausea, vomiting, rashes, diarrhea, constipation. The prescription refill is actually a really huge one. The neat thing about MDLI going from nurse navigation, physicians have the ability to have dispositions for an individual. So when you call and you're like, my elbows hurt for 5 days, it's 2 in the morning, I want to go to the hospital, they can say that actually is not. It's the gout you've had 10 times, you need a refill, I can call that in for you. And they can actually have that delivered to the person's house if they do not have the ability to go get that. So it gives them numerous avenues for resolving their issues. This is kind of the strategy of how it's set up. Right now, we're in the primary option up top where it says dispatch. The caller would, community member would call 911. It's routed through Aurora 911. Goes to MDLA. Again, some of the idea and some of the things that they can handle for them. Behavioral issues, they can set up, if you need some counseling, they can get you related to a counselor, get appointments set for you. Again, that disposition is what's really, really important. It was missing prior, is they can say, yes, you need this, no, you don't. Here's what you do need. Let me get that set up for you. We're looking at phase 2 eventually. Again, we're a week into this, so we're not quite there. We're one step at a time. The next step is also field providers, where we could respond. If it does circle back to us, we have the ability to circle them back to that and say, it looks like you really don't need this. You just need a medication refill, or we can get you those appointments and services. So that's kind of nice. This is kind of what the system looks like real quick, for both the caller on the left on the phone, speaking with the physician, and for the physician, this is what they would see kind of in the middle to have all their notes and to be able to handle it. Yes, it handles the lower acuity, making our units and the ambulances more available. But if it's something halfway through that the person's like, well, yes, it's hurt me because my chest pain's been going all night, they still have a way to kick it back into the system. So we have ones that do go back into the system, which it should, because we want to manage that person's needs appropriately. This is the steps of the implementation. We currently are at phase 5, where we just went live. We had to do the planning and committee formation. Again, we set it out to RFP. We had to make sure that it met all of the evaluated, the people who put in for it met all of the evaluated criteria, which MDLA did meet all of the things we were looking for, which is why we went with them. We did the technical planning. The training was in December and January with Ms. Benetta's group. They've been incredibly fantastic on board, really excited about it. Had some really good turnouts for it. And then phase 5, which was a week ago. Here's a couple examples of the things that you can have with it.
So when you talk about it, like 55-year-old male patient, gap pain times 3 days, no priority symptoms present, patient, just one, like we spoke about, prescription refill. Simple, done, out the door with that. 22-year-old male patient, traffic accident, 3 days ago, has knee pain and will not go away, right? These are the low acuity incidents that really don't require a full ALS transport or ALS response from either ourselves or even BLS from fault. 27-year-old female patient in a fight 4 days ago in a bar with another female, back's been hurting, not experiencing priority symptoms, and the scene is safe. 55-year-old female patient ran out of seizure meds, hasn't been on a recent seizure, but concerned she will if she can't get it. And speaking back to this, I don't know if you've ever utilized your own insurance carrier and tried to get through and get things done on that side. This is another route and an avenue that it expedites that situation. And what this allows, again, it keeps the heavy apparatus, for the more important calls that we need them to get to and be able to respond to. So again, improving our availability for that. So it's just, again, and at any instant too, that it hits a trigger, it immediately comes back into the system, is referred immediately and gets dispatched too. So.
In the world of check and balances, it's nice when they do come back, because it means they are paying attention to the needs of the actual patient. This morning, I just pulled the numbers. There have been 23 calls diverted out of a total of 58 calls that the Aurora 911's processed, averaging about 7.25 calls a day. So they've had 58, 23 they've been able to manage through the MDLA. That means there's 23 people that did not get an ambulance bill, did not get an emergency room bill, and had their situation handled appropriately to whatever their needs were. The very interesting numbers I took from this, there's also something that we're tracking called run hours avoided, which is at 40. That means there's 40 hours of heavy apparatus and ambulances that were not needed and were increased the reliability in our city, and 92 hours of emergency room time that was avoided. And that it helps everybody, from the customer and their finance, from the BLS ambulance that might be going to it, or ALS and the heavy apparatus, thereby providing a much better service. It fits with our right response, and we're super excited to get it going. So that's our presentation. If you guys have any questions, I'm more than happy to field them.
I'm gonna have questions. Here's the thing. Is there a cost to the person that calls?
There is no cost to the person that calls.
And then the other question I had was, you chose this particular group. Is there other cities or other states that utilize the same?
There are several other.
The Florida market, and then specifically like Tucson Fire, the Tucson area uses it extensively, and then they've also branched in the Phoenix area as well. So it's not just like, they're not just one area, that we're not their one stop, it's not a one-stop shop right now.
We're not technical.
We're not their, yeah, we're not their beta program.
Any other questions? Mayor.
How long is the contract for?
Contracts for a year, and it's not on, a long contract, so we want to make sure it works and be fiscally responsible, see how it turns out. The company we work with has a dashboard set up, which I was just reading from for you from this morning's notes. That's something we're watching to see the numbers are what we're expecting, and are we getting out of it what we expect to better help the people.
So people do have medical coverage, that's covering, for example, their prescriptions. Does that still get billed? And how does that work with, like HMOs, like Kaiser, for example, if someone needed to get Kaiser?
So they work with insurance companies and HMOs, depending who they are, to make sure that they're still going through their process if it's at all possible. I'm sure, I can't promise there's not a way that something hasn't gone wrong somewhere, that they've done it, as Chief was saying, they've done it in numerous other cities. They've not run into that problem, or it accidentally double bills or has another problem.
I'm interested, Tina, in how this has impacted you and how you've been working through it.
Thanks for asking. Actually, there's really been no impact to our general call taking, right? Because we're using the same protocol system to assess and then prioritize the calls. And so we were able to work together to integrate those prompts into the system. And then for our call takers, once they've identified that it qualifies for that service, they're conducting a warm transfer. And so by doing that, actually I think over time, I am anticipating that we'll see a reduction in call processing time for those calls, but it's too early to see the true impact.
And real quick, I mean, so somebody doesn't need to know to ask for MD Ally when they're calling, right? So I think you all get the questions from citizens and residents sometimes as to, why are they asking me all these questions? Well, those are our standard dispatching protocols, so we get to the right response. And so this is part of that, right? So when questions are answered in a certain way, we've worked with our provider and others to make sure that, yes, this is a call that could be diverted to MD Ally, and then they'll go through some of the rest of that. And then, as you've heard, there's some that do come back into the system, like, nope, there's some other conditions underlying that this is not available for telehealth. So again, when you all get those questions or concerns from residents, they ask me 18 questions. Yes, that's kind of the standard protocol. So we're making sure we get the right response, to that person.
So David, how has this impacted you with bulk and your calls for service with this coordination?
Yeah, it's a great question. Obviously, it's only a week into it. We would anticipate some of that volume going down, and most of our cost is based on the cost of readiness, right? To have that standing army ready to get on a quick response. So we want to be mindful of that, but through Chief Otten's right response program that Chief Hayes talked about, Chief Hill talked about, that is really important because, I've been a paramedic since I was 23 and I'm a long way from 23. And this is the sort of thing, that right resource to the right patient at the right time is what we need to be doing, because if you have one tool for every problem, that's not the right way to do it. So I personally am excited about the ability to tailor the need of the person who needs the help, getting them the best resource, whether it's MD Ally, whether it's one of our paramedic ambulances with the fire department, whether it's the Aurora Mobile Response Team for the behavioral health, lower acuity pieces. To me, it's part of that portfolio of the larger picture of how we deliver. So I'm personally excited about it. We do want to get some time under our belt to see how it impacts the overall demand for sure. But it will preserve those resources for those higher acuity patients. Everybody's emergency is an emergency for them. But if we can make sure that the car accidents, the stroke, the chest pain, heart attack victims are able to get the quickest response, because if that first due resource is already on a call that's lower acuity, then they're waiting longer for that second. And that's ultimately the goal.
Any other questions?
Do you anticipate any impact to the need and number of paramedics on the AFR force?
I don't. We're plenty busy. I think that, as the city manager was mentioning and referred to as right response, I think having the right people going to the right things just makes it more available instead of having more time waited for either an ambulance or a heavy apparatus to get there. We talk about unit reliability. We still have the same needs for our paramedics. Just instead of with right response and correcting who's going to what types of calls, as Mr. Patterson very well articulated, if I have a unit that's out on something over here and there's a call in this area, it's going to have to take, a heavy unit from another area, which is a longer response. And you still have to have the same people to staff those. It's just a more quick response to get the right people there.
One more, if that's okay. There are still folks, both in the older adult population and people with disabilities who do not have smartphones. How do folks like that access this, or are they not able to?
They absolutely are. It's telephone based. Those who do have smartphones, it's video based. It can absolutely be just a regular phone call, either a hard phone line or from a phone that does not have the kind of video capabilities. They still get the exact same treatment. And in fact, Roy 911 really doesn't know the difference because they're just on a regular phone call. They will transfer it to the physician can ask, do you have video? If they say no, that's fine. They can still listen to them. They're still talking to the exact same US based ER physician with the same question and answers.
It does, I go out once a quarter with different stations,
Sure.
do a 24-hour shift. And it doesn't happen all that much, but sometimes there's a frequent flyer who, for whatever reason, may not have anything wrong with them, wants to go in. And the paramedics that are with have no choice but to take that person in. How would this system have an impact on that? Would they be able to divert that person? But that probably knows how to say the right thing sometimes.
Yeah, you hit the nail on the head right there.
Yeah.
Aurora 911 has their ProQA, a series of questions that everyone's referred to get to the right thing. As the city manager mentioned, they go through all these questions to make sure they're getting the right response. They do have off paths. If they say I have chest pain or I've been shot, they can immediately send, and get people the immediate response. They don't have to go through everything. But there are people who do know how to subvert the system and say, well, I'm having chest pain. That will still get a chest pain response. But to play note to that, we do have plenty of frequent flyers, but they sometimes get chest pain. They sometimes have shortness of breath. I'm never one to say they are not having a true medical emergency just because they're having it. It's better for us to send that response because at the time that is the right response. If they get there and it's not, they do have ways, and they can in the future with the one slide we articulate from the field provider, they can get them into MDLA if you discover later it's not. But it's better to be safe than sorry and send the right response the first time. Thank you for your presentation. Thank you, Chair.
Over to 4B, 2026 calls, police audit plan and body worn camera audit results. Michelle.
Good morning, Michelle Crawford, City Auditor. And today I'm going over our 2026 police audit plan and then the results from our body worn camera compliance audit. So just a little bit of a reminder on our audit plans, we have two audit plans, a citywide audit plan and a police audit plan. To develop those plans, we take a risk-based approach in accordance with our standards, using risk assessment surveys, interviews, looking at prior audits, and then other reports in areas of risk. For my office, I have 3 auditors, and 1 auditor's hours are dedicated just to police audits every year. We do have one 2025 engagement that is carrying into 2026, and this is the police property and evidence inventory engagement, and it was started in the 4th quarter. We did expand this versus our normal high-risk areas to include looking at the inventory of DNA evidence, cold case evidence, and then the check-in, check-out processes, so a little bit more in depth than our typical audits that we've done in the past. For 2026 on the plan is the DNA processing and handling. And so the state does have regulations in place around the processing of sexual assault kits. Timely processing is important and crucial to our victims and prosecution of cases. This review will focus on ensuring that DNA evidence for sexual assaults is processed timely and complies with any state regulations.
Next, as the department looks at implementing facial recognition technology, we will be looking to see that they're ensuring that they're following with any state requirements and also internal policies, just to make sure that we're following what we're supposed to be doing. And then for police response time, so we previously have looked at calls for service back in 2023. Since that time in 2025, the department made changes to its priority responses. It's improved its tracking of response times. And additionally, Aurora 911 implemented a new police priority dispatching protocol. And so getting the right response to incidents in a timely manner is important. And so this review will focus on response times and follow up on any prior audit recommendations. Next, I'm going to be going over the results of our police body-worn camera compliance audit. So the audit scope for this was January 1st, 2024 through our audit work in July of 2025. And we did conduct this audit in accordance with our audit standards. The first objective and conclusion was, are Aurora police officers complying with body-worn camera policies and regulations? And we did find that they are generally complying with their body-worn camera policies and procedures. The second objective and conclusion was, for the reviewed videos, did Aurora police officers complete the required contact data collection form and any incident reports? We did limit our review to 50% of the compliance videos we believed a CDC form would have been required. And so we reviewed 19 specific incidents, and for those, officers did consistently complete the required CDC form and reports. Some additional background on body-worn camera compliance. This is our second follow-up audit and our third overall audit since 2020 on body-worn camera compliance. The majority of the audit focused on a review of randomly selected 99 videos from the period of March 2025, which went across all units to review compliance. And we did ensure we had no more than one video per officer, so 99 unique officers' videos were reviewed. This graphic chart shows the overall compliance and non-compliance. You will see muting was slightly lower. We do have a recommendation on some policy clarifications around that, but overall they were compliant in majority of areas. The first issue we had was with uncategorized videos, and so members did not always categorize their videos in accordance with policy. PD policy currently states videos should be categorized within 21 days of incident, and categorization is what is dictating how long we keep those videos in the system and impacts retention. We did see 225 members responsible for around 1,600 uncategorized videos, and 2 officers specifically accounted for 16% of those videos. Our recommendation is to develop procedures to ensure timely video categorization, including exploring system notices for officers and dashboards. We do have some policy clarification updates. The first is muting, and we're recommending policy clarify when muting is allowed during searches. And on deactivation, currently deactivation is addressed in the discipline section of the policy, and so we recommend it within the policy itself to make sure expectations are clear. And then for categorization, expanding it to address responsibilities for when someone departs or is terminated on who is responsible for categorizing those videos. And so the recommendation is to update policies as outlined in our audit. And the third issue is on test videos. And so the department uses test as a category. These are typically accidental videos. And these videos retain for 80 days in the system. Of 30 random videos selected with test in the category, 23 actually included multiple categories. So of those 30 videos, 7 should not have been categorized as test. However, only 1 had retention impacted because the other 6 had those multiple categories in place. We're recommending the department defines test category and policy and develops procedures and guidance on how it should be used. And develops procedure to periodically review a selection of videos with test as a category to make sure they're compliant. That is it. I'm happy to answer any questions.
I have a question.
Yes, ma'am.
So there was one that you said, one officer had 16%.
Two.
Yeah, 2 officers. What happens? Maybe you can address
And I can
that.
say, clarify, one of those was no longer with the agency, and that's where the recommendation came in for when someone leaves to go through and do the categorization. I believe the police department, I gave them information, probably looked at both of those individuals. And I know you guys have put some new procedures in place.
Yes.
Yep.
Yeah, we've already looked at that. We're already did discussions based, and the one that highlighted for us obviously was the muting one as well, and that came out. So again, the chief is already working with the staff, making sure that that's getting pressed down. We're looking at policy modifications. Again, I just want everybody to know too, the Aurora Police Department, we believe in body-worn video. It has been incredibly pivotal to our operations. Not only to show the view of the community, but also to tell the story of what the officers are involved in and how they are doing it. We have used it countless times. We scrutinize it continually. Not only do we have audits that conduct outside, we actually do internal audits quite often.
We had an officer that I adjudicated personnel complaint on based on body work video. We then did a subsequent audit in-house where we pulled up to, I think it was about 20 or so different events from different stops to verify this officer was acting correctly, acting constitutionally. And so that's something we constantly focus on. The recommendations that she's gotten, she's already talked with Chief Rathbun. Those have already been discussed with operations, and those are going to be things that will be codified and solidified in policies and procedure modifications.
Any questions? Going for C, fire warrant clearance, Vince?
Yes, thank you, Chair. I mentioned the success of our Fresh Start Warrant event at the last meeting, and you had asked for some follow-up data. We can, just to remind everybody, if you want to go to the top of this page, and then we can go to the one that's just the dashboard. But essentially, and this is thanks to all stakeholders in courts, judicial, court administration, the city attorney. We were able to plan and execute a warrant event with little notice, definitely looking back and in planning for any future event we would want. I'm sure that my fellow stakeholders would agree that more time in preparing and promoting it probably would be beneficial. It was rushed. It did turn out well. My office and other offices I know put a lot of extra work into the event. I have up here the eligibility. And so just to be really clear, this was not the Fresh Start Warrant event. The concept is not to allow folks to get their warrants canceled and also get their charges thrown out. Right? It simply, or at least our event was really focused on just canceling the warrant. 67, I think, is the final number of, the 73 warrants that were canceled were reset for future settings. We were able to work out some pleas, and I think with more notice and more advanced planning, probably, I don't know if you'd agree with me, Julie, but probably we'd be able to figure out a way to resolve more cases, maybe at an event like this in the future. I just think, again, that was sort of a product of being rushed and somewhat last minute in the plan. If you will go to just the dashboard. Yeah. So the first number here just shows that my office, we looked at 382 cases that we knew were cases of ours that were currently in warrant status. We reviewed those warrants, and I think the other sheet has something like we identified 240 something or 270 something of those that were actually would have been eligible. We reached out, or we tried to reach out with varying success. Most of our clients, it's really difficult to get in touch with them because they don't have good contact information, etc. The court canceled 73 warrants for the week. 56 people participated. 55 people had warrants that were cleared. There was one individual that showed up at our offsite location, which was at the homeless drop-in center, Aurora Mental Health Homeless Drop-in Center, who didn't have a warrant, but because he showed up, we were able to resolve his case that day virtually. And then reset 67 and closed 7 cases. So those 7 cases were a mix of guilty pleas and some dismissals. And then the disposition of the warrants generally, most of them, as you can see in the bottom bar graph chart, were people who showed up in person. Most of them were at the courthouse, not at the homeless drop-in center, although we did get a handful of folks who walked in there. Most of them, unfortunately, didn't have Aurora warrants, and so we really couldn't help them. But those that did, we were able to get before the court virtually and appear with them. And then 20 folks were actually clients who we had reviewed their cases, saw that they were in FTA status, and then were able to get out to see them in jail, where they were actually being held for something else, still had the warrant here, and the court canceled those. So that's sort of a kind of a big picture overview. I think that, you know, I was really excited that we were able to do this. I think we could certainly do things that would make it more efficient and perhaps more successful in the future. You know, and I'd ask for this committee's support in exploring that for 2026. And that's really all I have to share.
So how much runway did we have to roll this fresh start warrant then out?
Not much. Runway?
Not much. A day, a week, a month?
Month.
A little bit more than a month. So how was that communicated out to the public?
Put it on social media.
Comms did a great job. There was great promotion, social media, flyers, digital flyers in Spanish and in English. But like I said, it was, I think the first time we talked about it at a public safety committee meeting was maybe August or September, but we didn't actually pick a date and roll with it. I think we had like 30 days in advance. And so it was short.
So looking at this, the success, the results, are you looking, Judge, at maybe doing this biannually or again based on this result?
We do it every day.
You do it every day?
Yeah, we have a walk-in court where we handle people with warrants every single day. And just last year, we had 2,017 people come in for walk-ins. Of that, 693 had warrants which were canceled. That was what we did last year.
Okay, so what makes this particular thing unique from, since people can walk in every day?
I think it's just the messaging of getting the word out that if you come into court, your warrant's going to get canceled. You're not subject to any arrest.
Would they still have to, if there was any fines or anything like that, would they still have to pay those?
No,
No.
like I think mentioned, we're resetting a lot of those cases. There, I think it's 7 cases were closed out of the warrants that were canceled for the Fresh Start program. But just because we do every single day, canceling warrants, a lot of those cases are just reset. Yeah, we're just to let you know, for people that came in for 2025 last year, only 8 were detained and held on a warrant of commitment out of 693 people. That's 1.1% of the cases that people come in.
How does this tie into failure to appear? How does this tie into failure to appear?
Any warrant that's is for a failure to appear.
Okay, and
Or a potential probable cause warrant.
so we're just, so I'm trying to understand this. So we're just basically dropping the charges on all these people.
No. It's just canceling the warrant and then their case is rescheduled for another court date. Yeah, we're starting to see those cases that were part of the Fresh Start program being reset on the court's docket this month. Fortunately, we're also seeing failure to appear on those cases. So when we cancel the warrant, they're failing to appear on their court date in February.
So effectively, they're not getting penalized for failure to appear by virtue of coming in.
And their warrants canceled and getting a new court date, hopefully with them being paid, but we're still failure to appear in those cases again.
So they're avoiding arrest at this point for the failure to appear. I just want to make sure I'm clear because I still feel a little muddy on it. So,
You're exactly right.
okay, all right, I'm tracking with you now. Okay.
And we have a real-time portal that's set up to track all of our walk-in people and warrants, the number of people that are coming in for walk-in court, the number of warrants that are being canceled, the number of people that are remanded for it and held on a warrant of commitment. We've had 7 canceled since the beginning of this year. Not one person has been remanded and held on a warrant of commitment.
So I know your office kind of headed this up, Ms. Diz. Is there any kind of difference between the general population and your clients in terms of feeling comfortable just walking into walk-in court versus coming to an event like this? And are there any other considerations about the difference between this and walk-in court?
Yeah, I mean, that we have a walk-in court that is accessible every day, certainly, but if a client calls me and says, hey, I have a warrant, what do I do? You know, my advice and my office's advice, and I would assume any other criminal defense attorney, probably prosecutor, et cetera, the advice is you can come in and clear your warrant. The odds are you may not be arrested, but there's always that risk. So there can't be a guaranteed, you know, nor can we promote, you know, necessarily come in, and we can guarantee that you won't be arrested. You know, that would just, obviously in the one time, right, that the person did come in and ended up getting arrested, if they're then telling, you know, the bar that my lawyer told me that I would be fine, I wouldn't get arrested. You can imagine how somebody would be pretty upset by that. But the whole concept of fresh start events and warrant clearance events is simply to make that guarantee, to offer it as an incentive for folks to come in that we're going to guarantee you won't get arrested if you come take care of your warrants. The 16th and 17th judicial districts, and so do many other of the judicial districts, do these events, I think at least biannually, maybe just annually. One option, at least that I would like to see our court participating in, is to participate in their events, because they already have the infrastructure. They invite municipalities that are in their district to also, you know, engage with their warrant clearance events. So if somebody comes in on a warrant from Arapahoe County, for instance, and also has an Aurora warrant, they can get both canceled, maybe work out those cases so that there is a resolution and it's not just a matter of resetting. I would love to see, you know, an event where we were able to resolve as many cases as possible versus reset them, so that there isn't the risk that they don't show up again. And by resolve, I mean a plea bargain, right? So entering a plea of guilt is typically how that would work. I'll just say too that Judge Day had shared the statistics from the year in walk-in court at, I think, the last meeting, but even if you look at 693 warrants on the year, that's still quite a bit less than the 73 warrants that were canceled in 1 week, right? As compared to an average week, which I think is about 12 or 13. So it was a significant increase in warrants canceled. You know, again, I think promoting it as a opportunity to clear your warrant without an arrest is the key.
Not guarantee that they would not be arrested. If for some reason they came in and they had a felony warrant that we were aware of, we have to arrest them. So we cannot guarantee, even through the Fresh Start program, when they come in, that they will not be arrested.
You have a question? Thank you for your presentation. Great dashboard. Let's move on to 4D, 2026 Police District and Beat Realignment.
Again, thank you so much for the opportunity to go through this. I appreciate it, because this is going to be something that is foundationally different for the city of Aurora, without question, but it's something that's needed. The main thing I want to make sure everybody is aware of is that this did not occur in a vacuum. This has been something that has been ongoing for 18 months. There's been huge policy modifications. There's been huge changes. There has been an incredibly strategic approach to analyze and to understand the data that we are looking at as far as call load, crime load, victimization, and the results are what we're going to see here. Our goal, and without question, is to provide better service and to get to where we need to be when people need us. Big part of that also is to reduce criminalization. And my most important part that I care the most about is to reduce victimization. So if you could go to the next slide, please, I appreciate it. Again, where we are at now, and I'm talking from the period of, I'd say the past 18 months, I think this is important because this demonstrates a story of what the Aurora Police Department is at. We are down 16.7 in homicides. We are down 43.2% in motor vehicle thefts. We are down in our non-fatal shootings of a 5-year low of down over 54%.
That is absolutely huge. Our robberies are down 33.7%. So less people have been victimized by robberies, less businesses have been impacted, and less crime has occurred. Overall, our major crime indexes on all accounts are down 23.4%. How did we get here? What caused that? You can go to the next slide. Again, what caused it was we had these incidents solved. We focused on our non-fatals and our fatal shootings. We also focused on impacting those individuals that are causing victimization, the suspects. We focused very specifically on hotspot policing to make sure that we are getting our resources in the right place at the right time to ensure that we are not over policing in any way, but really addressing the activity that is impacting the community and the safety of the people who live in Aurora. Our arrests went up. 24, there was 5,891, and 25, it went up to 7,900. That's a difference of 3,075, which have been less victimized. Again, I always put it in correlation to what people can understand. If we build up a high school gym for a basketball game, we packed it. That's how many people have not been victimized in the city of Aurora based on these modifications, based upon what we are now going to be instituting on the 14th. Can you go to the next slide, please? Another big aspect that we wanted to change when I got here was our response time and our calls for service. Again, it's been a huge collaboration with our partner over in Aurora 911 with Tina. Chief Gaskill has worked on that quite a bit, but we wanted to understand why was the call load so high? Why? And again, the call load was incredibly high. We had officers that could not do any proactive policing 18 months ago. They would step in their car and their queue was filled up with 100+ calls. Calls were not getting answered. They were getting answered 2 or 3 days later. It was completely unacceptable. And so we modified policy to make sure that we got our call load down. So year to date right now, our call load in priority 1 calls have decreased by 23%. Our priority 2 calls decreased by 36.9%. And that is massive because basically on a priority 1 call, it went from officers wouldn't get there for maybe 20, 25 minutes was the average, to now we're almost below national average of a 6-minute response on priority 1 calls. And our priority 2 calls, which are just as important to somebody, because again, they want somebody to show up, and sometimes they weren't showing up for 2 days. Now they're actually showing up in a very timely manner, usually within 10 minutes. These modifications are why we're talking about the redistricting. If you go to the next slide, please, I'd appreciate it. The policy modifications that got us there that are kind of been the foundation of what we're going into the redistricting. It was about emergency response times. It was about how we went. It was about language that was being used, nomenclature on the air, what was not being used. And what the results were was officer safety improvement, risk mitigation. We're hoping for a 33% reduction on that. And to bring it more clear to you, and I don't understand why, I'm not going to talk about the past. I'm going to talk about the present, and I'm going to talk about the future of this organization. There was a time when an emergency call would go out for Aurora 911. You could be being victimized. You could be in an active event. It could be ongoing, and the units would not respond there code 3, which means lights and siren would not be activated. They would get there when they got there. And again, if you're the one that's, your house is broken into, someone's in your house, if you're the one whose business is getting robbed, if you're the one who's getting raped, if you're the one that is getting assaulted, you want somebody there. So why that policy was in place, I don't know, but we modified that policy. We did an extensive rescheduling as far as training aspects to get our officers to respond. We changed our policy and procedure on code 3 calls for run when they would be done. We also changed emergent calls. So you might have seen over the past 18 months, an increase in calls running with lights and siren. And that's the results of it, the reduction in those calls for service. If you go to the next one. We also changed our nomenclature specifically about what officers, how they requested help, how they requested additional officers. And that was a huge part of it too, because we wanted to prioritize safety. We wanted to centralize our dispatch control, our tone, how it worked and what it didn't work. And we wanted to make sure that, again, when I talk about risk mitigation, that's really important. So when I talk about the nomenclature, if an officer needed help, that call never came out. So we completely changed policy on that, where we said now it is an officer needs help call. We had an incident that I talk about. It's still unfolding. It occurred up in the parking spot up in 13. We wanted units to respond there. The officer was kind of controlled in how he put out his verbiage, how he put out his details. And the sense of urgency was there, but it wasn't as clear as what we have made in our policies now. If you need help, you put out help, and everyone will respond there and get there. And that is a big component of what we are trying to get instilled into this organization. If you need help for something that's not quite a code 3 call, but something that's lesser, then you ask for emergent. Someone will go there. That has been a game changer as far as risk mitigation for our officer-involved incidences where they need somebody on scene, but that nomenclature has not been in this organization ever before where they were able to articulate it out. And so we have normalized that to make sure that officers don't hesitate to use that verbiage to get units there, to make sure that they are supported and to make sure that a victim or a suspect is controlled, making sure that an incident doesn't have to unnecessarily escalate to something that didn't need to if there would have been more resources. So if you could go ahead and turn that next slide, please. These are the 2 policy modifications. If you could throw it up there again real quick and just click it one more time for me. These are the 2 things we did, policy dispatch, and then also the nomenclature that I just talked about as far as making it for its brevity and then priority. You go to the next one, please. What some of this stuff is done too, again, we talked about calls for emergency service, but I also wanted to put it on here because I think it's something that we sometimes forget. 18 months ago, it was normal in this room during public safety to have discussions about individuals walking into Home Depot, walking into Lowe's, walking into Walmart, CVS, loading up a shopping cart full of goods and just walking out, and there was absolutely no accountability. So we did an analysis based on those actions that we changed and modified, those policies and procedures, and what we are now hoping to do with the redistricting. This is an example of what we have done. We basically, on shoplifting calls, the losses have been less. We've cut down $1 million to businesses and people who own businesses in the city of Aurora. It went from 1,886,000 in loss down to 871,000 in loss. That's $1 million difference. And again, whether it's a corporation or whether it's a small mom and pop shop, that makes a difference. And it makes a difference in how they feel about their department and how they feel their department is answering their needs for service. If you could go to the next slide. So why did we change what we changed? Again, we are in a state of continuous improvement, and that's what we looked at. Right now, the way the districts are set up, you have districts all the way down in Southland, which is 3, that are sometimes responding to calls, or they have areas that are all the way up on the north end. Right now, the boundaries for our districts are basically north and south, so we are changing them from east to west. We are trying to use geographical boundaries. We are trying to make sure that we adhere to call loads for service to make sure that these districts get what they need and how they best need it. So the District 1 is north, District 2 is central, and District 3 is south. Go ahead and turn the next slide, please. So what is changing? Again, the beats are changing. The district boundaries are being adjusted. Patrol staffing to align with peak demand on periods during maximum efficiency. Again, we wanted to make sure that the events, the locations, the areas that need the resources get them, but also make sure that we aren't over policing, making sure that we aren't under policing in some area. So we really wanted to look equitably. Where is our staff? Where are our personnel? And are they in the right place based upon the calls for service and based upon the criminal activity, based upon the hotspot information of what's occurring in and around that event? And so that's where we also focused. We also looked at our PAR officers. They're going to continue to be assigned to each district. Nothing has really changed drastically on that. Again, our PAR do an incredible job and we're thankful to have them. They're still going to focus on neighborhoods, community needs. And then there's going to be 3 additional officers that are added to strengthen the PAR relationship and the PAR component. Next slide, please. Why the need for redistricting? Again, like I said, this didn't occur in a vacuum. It wasn't something that we just came up with a week ago and said, hey, let's go ahead and throw this against the wall and see if it sticks. All of these things that I talked about were strategically in place long ago to start this process so that we could turn the key on this and make sure it's effective and make sure it's a benefit. So we looked at documented workload. We looked at imbalances of some beats that have incredible call high loads. And then we looked at other beats that had absolutely no calls. And so again, we're reusing our resources and our personnel in the best way. We also looked at service inequities, imbalances, response, capacity, officers' workload. Was it consistent with the overall picture of the city? Or was it an outlier, something that, again, we had one unit or one officer working in an area that was incredibly intense. We had 3 officers that had very little call loads or in service time. That was something that I said, well, can we modify that? Can we change that? And so again, through the analysis, that's what it showed. We also looked at outdated boundaries. Again, the boundaries that have been in place now, this is not the Aurora. And again, I'm not from Aurora, but this is not the Aurora that was here 18 months ago. I don't think it's the Aurora that was here 5 years ago. And I don't think it's the Aurora that was here 10 or 20 years ago. So those boundaries are something that we had to look at based on the present, based upon the time, based upon the allocation of resources, and based upon too, what the future is going to be. I had a chance to talk with the city manager and I looked out at north. We looked at where industrial is going to be on the flight path of DIA. We looked at where residential is going to be. We looked at what we talked about on Saturday really briefly about the redistrict of 4 and how that could come into play, how in the future, again, many of us will never be in these chairs in 10 years, but there'll probably be a 5, and there'll probably be a 6 redistricting someday, I'm hoping. And so we set those boundaries to make sure that they have that same impact and there's longevity to it. And it's really about looking at the overall picture. You can go to the next slide. So here's what I talked about as far as review of period calls for service and the percentages. Again, in D3, we had 25%. In D1 is our high call load at 41%, and D2 is 34%. So with this modification to the redistricting, we're looking at new boundaries, which are going to put D3 at 31%, D1 at 34%, and D2 at 35%. So again, instead of having one command that had little call load, but same resource, same staffing, we wanted to make sure that we spread it out amongst everybody and everything so that all the calls for service are handled appropriately, quickly, and effectively. If you could turn the slide, please. So why now? Again, the start date for this, it happens this Saturday. We are going to flip the switch on it. Chief Gaskill has done an amazing job of preparing his resources. He just had a meeting with all of his staff. We went in there and we talked. We basically had the same discussion about what we are doing right now. Socializing this, making sure that they're aware of what it's going to be and what it's not going to be, and understanding the steps that we have taken to get there. The bid implementation is going to be impacted by what we do here and how it works. And also we want to make sure that there is no disruption as far as the emergency services or continuity of operations once this switch gets pulled, and all officers dispatch are trained in new boundaries. And again, the partnership with Aurora 911 and with Tina has been absolutely amazing. We could not have done this without the collaboration of that. So again, thank you so much. And as you can see, those are the new district lines. Chief, if you want to articulate on anything on those real quick.
The new boundary lines, like the chief said, goes east to west. For District 1, their southern border will be 6th Avenue. For District 2, it'll be Jewel Avenue, which is similar to where the 2 to 3 was now. So not a large increase. What a noticeable increase in size in for District 3 is they're on the other side of 225 now, where before they stayed at that spot. Obviously, District 1 North has the large piece, especially going all the way out east. But as the chief mentioned, that's in anticipation of a District 4 going out there that would most likely wind up consuming that area, that beat 10 and probably some of that beat 8. So that's kind of how it was laid out. And I'd also like to thank IT for the collaboration on this as well. They were extremely, extremely helpful. So Scott, thanks.
And again, when I talk about that call load and that response time, so before District 3 would be going sometimes all the way up north. And when I talked about that officer involved shooting, that to me is a tragedy. An officer was involved in that incident for almost 7 to 8 minutes with nobody on scene. 7 to 8 minutes being involved in a fight for your life is probably like 8 years. Actually, the first unit that got on scene there was a Denver unit that responded and got down before our officers got down. So that is a big part of what we are doing. Because again, had there been more officers, had it been different, it might have been a very different scenario and a different ending. So that's what we are constantly looking at as far as risk mitigation, community service, and ensuring we're doing the right things. You go to the next page, please. What our residents should expect, again, ongoing transparency. We're continually putting this out. This information is being reported on our performance metrics, is how we are doing it. Service consistency, again, as I mentioned, when we flip that switch, again, we want to make sure that we're doing it the right way for the right reasons. Clear boundaries are going to be well defined. Our PAR team, like I said, we added 3 to those, so it's not going to be a huge change for the community and for the businesses that want that PAR component and that relationship there. And then the equitable response is something incredibly important to me. And then one thing without question, and it's on the next slide, I believe, is our audits. And maybe it's coming up a little bit later on. But what we hope to do, again, you're good. Go to the next slide, please. Yeah, thank you so much. So this is what we bring to it. Again, what the new beat structure will achieve. It removes operational unsustainable workloads. Again, too much, too little. It gives a better range of what they can and cannot do, making sure we don't over police or under police. If hopefully it's going to have a consistent response, we're going to be able to improve, actually get better on our response times, not just maintain it, but improve it. And then also strengthen our officers and community safety to those that we serve. And then how do we measure all this? The next page, if you could. Again, the evaluation process, I wanted to make sure we looked at Q1, Q2, Q3, and Q4, and look at the whole business year as a setup. And so we're looking at audits to verify how we are performing, what we are doing. Those will be in collaboration with Aurora 911. They'll be in collaboration with ITT, information technology, to make sure that, again, we have not bit off more than we can chew, and then really to make sure that it is functioning. So audits are going to be a big part of that. The one thing I want to be really clear about on this too is this isn't in cement. If we start this and there's a failure on it, or if it's not working right, we're going to modify it and adjust it. Again, quality through, improvement. It's not a perfect system, but we're going to try to do as best we can. And if we identify issues or problems, then maybe in a year we'll be back here and saying, hey, here's what we changed. And we did go back a little bit, but we'll find that out once we turn the switch. But the main thing when we find out, it's not going to be at the compromise of the people we serve. And so that's really what this evaluation process is for. Go to the next slide, please. And that is it.
Thank you so much. Any questions, Chief?
Yes, sir. This, not necessarily related, but, where are we staffing in terms of the civilian, non-injury accident, investigators? How's the staffing going on that?
It's going well. Again, I would like to increase that. I believe in the civilian nation. I believe in what they do without question. Right now, we have a good number that are out there. I think we always can go higher. Overall, and the city manager is well aware of it, we are doing incredibly well in our staffing. But what's more important for our staffing is our attrition rate is down incredibly low as well. So people are not leaving. They want to get in here. In regards specifically to the CSRs, that's something that we're always trying to build on, but it is based on funding.
Because I know that, a lot of residents that they get into a lot of accidents. And it's non-injury, they're not blocking traffic. They're told just to exchange information.
Yes.
Obviously they would like a third party, kind of looking at the issue. And so, anything that can be done to help that process would be great.
And we are constantly looking at, we constantly look at their numbers too, and the numbers that they produce are absolutely amazing. They really do. And to put it into context, the value of it is that when we have a CSR doing a traffic accident, a non-injury, kind of the low-hanging fruit, armed law enforcement, sworn, post-certified officers are out in the street, being able to be proactive, being able to go to those calls for service. And that's been a big part too of the decrease in response times.
Because a lot of times you're just told to exchange information.
Yeah.
Okay.
Any questions?
Chair,
Here, that's it.
just with some of the numbers, I like to hear the numbers, but I want to understand a little bit better where they're coming from. So with the 3,755 number of people not victimized and the 33% decrease in lethal response, can you clarify kind of how were those numbers arrived at?
Yeah, we looked at our numbers from last year. So year to date, we have a PAC report. So we look at those numbers and then again, we base it on what occurred the years prior and then where we are today.
Okay, so it's just year over year,
Yeah.
and essentially it's a fraction
That's
of
pretty much
last
it.
year.
Yeah.
Any other questions for Chief? Let's move on to 4E. Chief?
Okay, again, this is a discussion. Again, I appreciate the platform again to talk about this because I think this is something that a lot of people have concern about. And I think it's something that without question is in the news. It's something that we are all seeing. And I think it's important that we bring factual, real information to reduce panic that might be out there. And also to bring reality to what the Aurora Police Department does and does not do. And what the Aurora Police Department does not do, we do not enforce federal immigration laws. Our role is enforcing state and local criminal law to protect the community and the people that we serve. So real quickly up on the slide, APD and state law, it pretty much spells it out. We are not in the immigration enforcement business. Like all municipal law enforcement agencies, that is not the role that we do. That is the role of federal enforcement officers and federal agencies to enforce immigration. That is not the role of a municipal law enforcement agency, and it is not the role or something that the Aurora Police Department does. We only make arrests related to crime, whether it's immigration or non-immigrant status. Again, I think that's really an important thing. Immigrant status is not a factor in who we stop. It's not a factor in arrest. It's not a factor in investigations. It's not a factor in serve as victims or witnesses. To us, our victims are our victims, regardless of legal status. We do not hold offenders for immigration status alone. We do not inquire about immigration status during any stops or any official events that we are involved with or participating in. Colorado law prohibits that. That is something that we adhere to, as we adhere to all laws and all constitutional items, whether at a state level or at a federal level. And that is what we focus on. You can go to the last page or the next slide, please. One thing that we do is adhere to the Lake and Riley Act. That term, we go above and beyond this law. To me, that was really important because I want people to understand what that Lake and Riley Act was a request to do. The Lake and Riley Act basically requested that law enforcement provide information to DHS on all individuals that were arrested for particular crimes. Those particular crimes involve burglaries, acts of serious or violent offenses, thefts, larceny, shoplifting, ADW, assault with a deadly weapon on a police officer, or property crimes with repeated victimization. So we are adhering without question to this federal law, but we wanted to make sure that it wasn't singled out on any particular individual or group. So what we decided to do is provide the entire list of every individual that the Aurora Police Department arrests. That information is then sent to the DHS, and they have the opportunity to do what they do at a federal level, to vet and to go through those individuals that they have interest on or are in violation of federal laws. You could go to the next slide, please. Again, the policy modifications that I have here, it's also up on the board based upon what we were seeing in the country, based upon what we were looking at. We wanted to ensure that our officers and our personnel were clearly trained, clearly understood, and clearly abided by the policies and procedures that I just articulated out in detail. So on September the 22nd, 2025, the above policy was put into place and it was sent out for training to all of our personnel. Basically what it does is gives an idea of who is contacted, what they are contacted for, and where that involves. And it also details specifically what we do not do. Request for personal identifying information for the sole purposes of determining someone's immigration status is not permitted. Again, do we arrest undocumented individuals? Yeah, we do. Are they involved in criminal activity? Yep, they are. Do we arrest them based upon their status? No, we don't. So if they are involved in criminal activity, they are going to be held accountable. If they are victimizing somebody, they are going to be held accountable. If they are going about their life and we do not have a need to contact them, if we don't have a need to be around them, there is never going to be anything in regards to us going out and seeking to identify who is documented, who is undocumented. If you go to the next slide, please. I'm a big believer in flow charts to kind of dumb down the information to make sure that our officers have clarity to what they are doing and how they are performing. And so this is within the policy as well. If you pull our policy, which is on our website, you can look at this policy. It basically shows exactly what the officers are supposed to do. So in a police encounter, they ask standard investigation questions within the Fourth Amendment. If there is reasonable suspicion or probable cause for a criminal offense, yes, then they investigate, they enforce all the applicable offenses. They coordinate with and request assistance from any federal partners if and when that is needed. If it is no, they cease detention. They don't share or disseminate personal identifying information for immigration enforcement specifically. On this one, I think it's important too to put it in context. Again, do we use federal partners? Yes. We have always used federal partners. Law enforcement has always used federal partners. Those have always been a part and a component of the law enforcement picture. Again, I have gone through 7 presidents in the time that I have been in this position in law enforcement, and the dynamics of federal partnerships, the dynamics of immigration has not changed during that period of time. Law enforcement has always used federal partners in every one of those scenarios. And there's a reason for it, because they have understanding, they have abilities that if someone is involved in criminal activity, if someone is victimizing somebody else, they have identifiers and information and the opportunity to have an impact on a situation that we may or may not. And I really bring this down to local levels. On Dallas Street, again, it seems like old ancient history now, but it wasn't ancient history about 17 months ago. 17 months ago, people are in that complex and they were being victimized, they were being tortured, they were being extorted, there was sex trafficking going on, there was narcotics use going on, there was major victimization that was occurring. Again, we focused on that from a hotspot policing aspect to make sure that we did what we could do. Again, the individuals that were involved in that criminal activity, it's incredibly unfortunate because like we see over and over, they are usually victimizing people within their own immigrant community. And that is an exact example of what occurred on Dallas Street. It was immigrants who were victimizing other immigrants. And so, again, being able to have those relationships with federal partners, being able to identify individuals that were involved in criminal activity, hurting people, raping people, extorting people, and then being able to identify them, it was a huge part of the win and changing the dynamics of that location and that dynamics of that neighborhood. But this is for the most more routine. Again, if they are not involved, if there is not probable cause or reasonable suspicion, the officer does not get into immigration whatsoever and they move on. If you go to the next slide. Now, specifically, when we talk about the APD policy related to requests for assistance, again, if it's a judicial warrant, yes, it goes up to civil detainer, command confirms, identifies it. It is not assistance for a judicial warrant. Again, there's a judicial and then there's civil. Civil is solely based on immigration. Judicial is based on criminal activity that's related to the status. So again, we've had warrants that have occurred by ATF, alcohol, tobacco, and firearms, FBI, DEA. They have come in here. If they needed resources or if they needed us for perimeter control, we would verify, is this regarding specifically immigration? If it is not, if there's a crime connected to it, that's where that support would come in. If there is nothing down, again, it'd be treated as any other law enforcement assistant. If it's a pre-planned immigration, yes, the duty exec is aware, but we don't get involved in it. No, it would be a coordinated response and we would go and support in whatever way is needed. And I think that's something too that sometimes doesn't get understood. In the past 2 weeks, we have had FBI, we have had ATF, and we have had DEA serving search warrants in the city of Aurora. And again, we're not involved in all those, but if there's issues with it, we are there to support. We have transitioned some things that we have gotten involved in back to FBI because they were the ones that were doing the investigations. But none of that relationship, none of that partnerships involves any aspect of immigration. And that's why this flow chart, and that's why our stance, bottom line, municipal law enforcement is not involved in immigration. We are involved in solving crimes, stopping crimes, and more importantly, we are ensuring, and I hope that individuals, whether you're in the immigrant population or not in the immigrant population, you know that you can call the Aurora Police Department and we are there to serve you, not based on your status, but based upon the victimization that you have been subjected to. And that will never change. It has never changed and it never will change. If you go to the next slide, I think that might be it. Our extra steps, again, what we focus on as well. So again, we make sure that we comply with Colorado state law. Compliance is update on policy that I just talked about, we sent out. And then we also have what is known as the U visa program. And we are incredibly entrenched in the U visa program because again, when I talk about victimization within the immigrant community, that is something I take very seriously because when you think of the dark element of crime, by steps like this, by clarity and discussions like this, I hope that we don't have that. And the dark element of crime is where somebody gets victimized, but they feel that they don't have anybody that they can turn to because if they turn to law enforcement, if they turn to a municipal agency, their immigrant status will be part of a removal process and there won't be focus on the victimization. That is not the case. Again, the U visa gives an opportunity for us to understand who has been victimized. There are qualifying crimes that are related to it, such as domestic violence, sexual assault, human trafficking, kidnapping, stalking, extortion. And we make sure that we go through case by case. If those individuals have been helpful or have been part of the process in the conviction of individuals who have been involved in that victimization, we make sure that we support them through the process of the U visa. And I believe that is it.
Any questions? April.
Yeah, I have a few questions just to follow up on, in relation to kind of the commentary about immigration status is not a factor at any point. We don't record that immigration status or request it. In the documents that we retain, such as police reports, are we including information like country of origin, type of identification provided when asked for identification, anything like that that would then be an opportunity for someone's immigration status to come into question? And if so, are there ways that we can minimize the potential release of that information to promote community trust?
Yeah, and again, thank you for the question. And yes, we do collect country of origin, but we never say country of origin is related to whether they're documented or undocumented. And the reason we do that is because we want to understand our suspects and we want to understand our victims. So when you look at victimology, I need to know that individuals from the Venezuelan community are getting impacted. The only way I can measure that, the only way I can understand about where to get my resources, when to get them there, is if I understand who is being victimized. Same with the suspects. Again, I want to understand what is their country of origin. I don't care what their, again, we do that on our booking sheets. I was born in Idaho. I was born in Pennsylvania. That is not a deviation from what is the norm if you are in custody for a criminal offense. There is nothing special that we are doing that wouldn't be done if you got arrested tonight, that would happen to somebody who is undocumented. It wouldn't change. It's exactly the same process, the same accountability component. It gives us analytical information to focus our resources on individuals that are causing the crime. And then more importantly to me, which is often forgotten, but the ability to focus on the victims and understand victimology better and understand how we can serve them better.
And so, sorry, just on the follow-up, is there anything we can do in the relation to how we handle our documentation to address fears and concerns from members of the public about that information potentially being inadvertently released if they contact the police?
Yeah. And again, I appreciate that question again too, because I want to make sure if there is community from the immigrant community that's listening to this, again, that information is all internal. There's nothing that we're taking that and setting that as, you know, as far as like Lake and Riley or something like that, where it's getting sent someplace. It's just internal information, and it doesn't go out. It doesn't go out on presentations. It's internal information. The only way you would get it is if you made a specific request to pull that information.
And so, sorry for the
That's okay.
many follow-ups. If, for example, information about a case was subpoenaed, does that internal victim information have any protection whatsoever?
In all cases have protection. And again, I don't know if you could articulate a little bit more about that, but yeah.
It depends on the type of case and the nature of the subpoena, right? So every subpoena, you're going to evaluate who's the requester, why are they requesting the information? Do you have a protective order in the case where the records are being subpoenaed that would request that information? And when we get subpoenas for records, often from third parties as part of other litigation or in court cases, oftentimes we're either applying redactions as appropriate or ensuring there's a protective order in place. So only the attorneys that are part of that case can access those documents and information via court order. And then that's a separate process. And of course, the CCJRA type request, whereas there's statutory redactions for certain victim information, depending on the type of crime and other things. So is it theoretically possible that that information is released in some contexts? Yes, but in many cases, we're going to be applying redactions and complying with the CCJRA and the, the Harris factors test and the type of information we're releasing to requesters and sort of balancing that need for, public transparency, but also privacy and mission.
Thank you so much.
Chief, I think, you and I have had a couple meetings, at least, I think 2 or 3 meetings with consul generals who have strong ties into their respective immigrant communities in the Denver metro area. And you certainly relate to them that we don't enforce immigration law, so to encourage cooperation on criminal laws. But what other things is your department doing to get that word out to those immigrant communities?
Yeah, and I'm very excited about this. We just started up, again, it's been part of the strategic plan of what we wanted to implement, but now we actually have feet to it. We started a community, or chief's community crisis team. And in that, I have somebody from the immigrant community. I have also somebody from the Venezuelan community who has real ties with general counsels for Guatemala, all those things that we talked about before. They've been really good partners with us. And we had our first meeting. The board's it's been built up, and the meetings have been in place. But we actually had our first one last like 2 weeks ago, and I was able to go through this exact stuff. And that to me has been the compelling thing, because what I asked for in this crisis response team, I didn't ask for individuals that just wanted to come and listen. I wanted lever pullers. I wanted people that had influence in their community, so that if we get involved in a bad incident, if we get involved in an officer involved shooting, again, real clear information could go out and not misinformation. And so I mentioned the immigrant population, but we also have members of the Black community there. I have members of the LGBT community there. I have members of every community. I have clergy. I have a Muslim. I got everything that you could imagine. And these are lever pullers within their community. And so that is part of the strategy, is to make sure that people understand that we are here to serve, not based on your status, but based upon if you have been victimized of a crime. Outreach is nonstop. Again, the Dallas location I bring in as an example. When they got moved through the partnership with the city manager, they went to 24 different locations throughout the area. And we are focused on those areas to make sure that they are getting information so that we don't see that repeat. And that's something that people don't think about, but we have had the opportunity to do preventative approaches where PAR teams, where our officers have gone out, door knocked in Spanish, handed out flyers and said, hey, if you are victimized, make sure that you call us so that we can stop something before it happens. Because we have had similar takeovers. We've had similar apartment takeovers. We've had similar activity, very consistent with what occurred. But the best part is that we have had incredible relationships and feedback by people in the immigrant population that before might not have come forward as victims, but now they have come forward. And so again, it's not going to be something that happens overnight. It's something that, like any relationship, it takes trust and it takes commitment and it takes growth, but it is something that we're really pushing into and making sure that we have.
I have a question for you. Can you clarify, when is ICE allowed on city property?
Yep. And again, I think this is really an important aspect. Again, ICE is a lawful federal agency, and they are enforcing defined statutory laws that are put into place by Congress. And so again, when they come or go, that's based upon their practices, their policies, and what they feel they need to be at, where and when they need to go. For us, the one thing that I hope for, I do have incredible collaboration with HSI, Special Agent in Charge. And that's not a collaboration to sit to discuss what's going to happen. It's a collaboration to understand that, hey, if you go in there, if you're focused on that, again, we're not part of it. We don't need to be part of it. But that communication component, again, allows me to have clear, defined understanding of what's occurring so that that can be articulated back into the community that might be impacted by that. But they can come and go as they want. Again, same as FBI, DEA, ATF. They have that opportunity. They have their mission. They have their function. They are a law enforcement agency, and I think that sometimes gets lost. And I also think what gets lost, to be quite frank with you, ICE doesn't want to have us doing immigration any more than I want to have them doing pursuits of stolen cars for crimes that occur in Aurora. They have their function and their mission, and they are staying in their lane. And I'll be honest with you, a big part of why they're staying in their lane is because of the open communication that I have with them. The open communication that, again, is not something that, no, this is not going to happen. And it's like, well, now we'll show you it's going to happen. It's been very positive as far as they're doing what they need to do. They are staying within their guidelines, with their boundaries, their guardrails, and we are performing our task and our job of service to people that have been victimized and to fight crime.
Any other questions for Chief? Mayor Pro Tem?
Have a few follow-ups. So on that last one, in terms of city property, not all city property is public. And maybe this is more of a Jason question than you question. Are ICE agents permitted to enter non-public areas without warrant?
Not without it. So we've worked with the city attorney's office, you know, we've had that question from our libraries, from our rec centers, from those areas. And so the answer is, if we were to have agents show up, they're to contact the city attorney's office, and essentially we can, again, as the chief said, they can go, you know, they have free access where the public would go. If there's non-public access, then we would be requesting a warrant.
Then another follow-up with respect to the Lake and Riley Act conversation. So I understand we essentially provide information about all qualifying crimes, any person, since we don't collect the immigration status, that's not included. Do we provide that information post adjudication or at other points in the process?
Yeah, it's supplied after the arrest occurs. So every day it's sent.
Okay, so it's not post adjudication?
No.
It's post arrest?
Yes.
Is there any reason why we couldn't wait until someone has been adjudicated?
On the other hand, my understanding is the federal law is not,
It's a federal
promoted and
mandate.
convicted. It's
I'll
actually.
let city
Yeah.
attorney.
I think
That's
it-
correct. The act requires that data to be sent after arrest, pre-conviction. So we're complying with federal law just regarding the DHS notifications. And again, the only way we can comply is to send everything to Chief's point because we don't have the data parsed out. Otherwise, we're doing exactly what the law requires, just with an expanded, set of data because we don't know what else we can send that's compliant.
So, sorry, just a follow-up. So I think we all know that all crimes are alleged until adjudicated. So we don't have any ability to protect those due process rights of our constituents by waiting to send that information until post adjudication. It's required to be sent prior to adjudication.
That's
Or
what the,
just all of the information, right? Could we say, we're gonna send you arrests, charges, and convictions, but we're gonna wait until such time as it's been adjudicated to send all that information?
no, the statute requires the arrest data to be sent.
My understanding is if the information we're sending, if someone were to put in a Quora request or CCJR request, we would release the same information. So if they had a standing request every day where they put it in, say, hey, who have you arrested on these incidents? We would release this information.
That's correct, because arrest data is a record of official action, which under the Colorado records laws, those are required to be released and reported within 3 days' time.
We understand the concerns around it, but again, and I think the purpose behind Chief showing you that is obviously the state law is very clear. We don't get involved in this. And then you have the Lincoln Riley Act. That makes a very fine line that we're asking our police agency to walk. And so we're trying to demonstrate how fine of a line that is and how we're trying to walk that line.
Due diligence and in good faith.
Without question.
That's an important distinction.
And just, sorry, as an additional follow-up, is the information that's provided, does it include the redactions that would be included in a CCJRA request, or are we just sending all of the information of all people arrested?
Yeah, just a name and a line. That's, yeah, and I don't think there's any information that would be redacted.
Just name the crime. Anything else?
No, and I think an important distinction here is we're sharing this through NCIC, correct? And NCIC is an internal law enforcement database that isn't like an open data, open source record that's not anybody, Joe Schmo, can go look up. Only law enforcement agencies have access to NCIC data. So that's the mechanism that it's being shared. So it's not like it's just out there and somebody can go open it up on a Google sheet or something.
So it's not going to the post.
Correct. Yes. And somebody could certainly make an appropriate records request. And if statutorily required, we would release that data or arrest data the same as we would anything else, but not this broad set of information that's being reported on a daily basis.
You'd be like based on, like a request.
Any other questions?
Well, you're right.
Any miscellaneous matter consideration?
Yeah. So Chair Andrews and I have discussed at length the Supreme Court, the Camp Simon's Supreme Court case and how to address it. We've been working with staff on trying to navigate the necessary code changes, which are going to be extensive. But in the interim, have discussed asking that the city attorney's office and the public defender's office, and they're both aware of this, this is not news. These conversations have also been had, but that by our next study session, that they jointly provide to us a list of all of the city offenses versus state offenses that they agree are identical conduct that would be implicated by Camp Simmons, sorry, not Simons, and instances where they disagree on where those line up so that we can discuss those and get clarity for folks that are moving through our court.
Say anything for that piece, but I mean, if you need a response on that, I was gonna sort of look at the judge and Julie, I guess, to, if there's anything else they have to add, and Elizabeth, I think they understand the request, and I think, yeah, I know Pete's.
You just
working.
mean like a list of, I think we have a list from judicial, we probably have our own lists as well.
Right.
You want us to talk about what we agree on.
Right, get those lists together so that it's all, there's just one list and it's comprehensive.
Okay.
And if there are areas of disagreement, that judicial, prosecution, defense kind of explain the reasons for the disagreement.
Okay.
So that we can, yeah, get that settled.
It's going to study session.
It's going.
Yeah, because it's been that by then it'll have been 2 months that we are potentially illegally sentencing people. So we gotta get this moved. And again, there have been a lot of conversations that I've had and that Councilmember Andrews, Chair Andrews has had with Pete, some with Elizabeth, lots of conversations with Pete, and some with Judge Day about this issue. So yeah, we don't have time to come yet again through the process, but it was just kind of clarifying that direction and that discussion that's been had and making sure that it is public and not just behind the scenes.
How would they comply? How would that comply with the
No, it's about the whole other issue.
Okay.
Miscellaneous, right?
Okay.
Yeah. Yep.
Other business.
I do have, sorry, another miscellaneous, which is just that for next public safety meeting, I have had requests from the community to consider policy regarding the use of masking by ICE. So that I will ask to have on the next agenda for this meeting.
Why would we have it? This whole government, why would we have anything to do with what ICE does?
Our community members have expressed extensive concern and we have home rule authority.
And nevertheless, ICE is a federal agency, what would we have as a municipality to do with that?
I mean, that's obviously a loaded question right now that I think there's a lot of concern with. I know that Denver is exploring a similar ordinance, but I would say that there's of course a lot of legal considerations on it. So it may be appropriate, Mayor Pro Tem, if you want to slate that item perhaps for an executive session to maybe get some legal advice or parameters on that, and then bring something forward to study session after council receives that advice, potentially in an executive session.
Yep, if there is an ordinance, so obviously we will want to take it through the full process, including research.
No other items in our next meeting is March 12th, 2026. With that, you're adjourned. Thank you for coming.